medical staff have written to President Cyril Ramaphosa asking him to set up a task team to address the worsening crisis at the Charlotte Maxeke Academic Hospital. They say they've had to endure months of difficulty in order to care for patients who were affected by a fire that gutted part of the hospital in April. The situation worsened this week when part of the facility was flooded and compromised crucial bed space for patients and possibly damaged life-saving equipment. Let's discuss this then with Nursing Union Genosa's Gauteng Provincial Secretary Bongani Mazibuko. Mr. Mazibuko, a very good evening to you. Welcome to News at Prime. So just what is the scale of the mounting problems at Charlotte Maxeke as per your understanding?
Well, it seems that it's a never-ending story of challenges with Charlotte Maxeke. It was first the fire, then after the fire, when the hospital was resuming services, there was that looting of gadgets, steel pipes and so forth. And the latest one is now the flooding of the water. It has happened on 2 occasions, which is actually compromising service delivery and the way the staff are working. Things are not in order at the hospital.
So the doctors who've written this letter to the Health Minister, Joe Phaahla, and the President are saying that the flooding incident this week compromised bed space of more than 200. In fact, I've got the breakdown here. They say 7 wards were affected. That's 200 beds and 2 intensive care units. That equals to 30 beds. Has any of that been addressed and resolved already?
The hospital is trying to resolve, but they don't have adequate space, because what has happened is that with the flooding, what caused the flooding was a supply of the main water pipe to the hospital. So as a result, that had to be closed down, and then patients had to be moved to other areas which were not affected by the flood. So that means then that the flooded areas need to be sorted out first before they can resume. I'm hoping we are still waiting for the people at our members and the shop stewards in the institution who are still engaging with the management, and where they are not coming all right, they said that they will then involve us so that we can intervene and assist. But at the moment, they are engaging with management, and what we are told is that they are trying to resolve the crisis and make the bed space available.
I'd like to pick up on the issue of people being moved to other units that were not affected by the flooding. And I'm wondering about the quality of care then in those situations. I mean, we're also in a pandemic where we're told we need to limit the number of people in any room. So when people are already ill, who do you put where? And how does the staff-to-patient ratio work now?
Remember, we still have other staff members who are not even back yet at Charlotte Maxeke. So that is why this is making, I think that is what prompted the staff members to end up writing to the President and seeking intervention with the Minister as well. Because you've got a hospital that is already short-staffed. Some of the staff members are not yet back from the hospitals that they were deployed at after the fire took place. Now, that exacerbated by the fact that you've got units which are not yet working, and you have to take people from the units which are full because they're affected by the flooding of the wards. Now they need to go to other wards. So that in itself, it causes a lot of problems operationally. But the institution needs to be having a crisis or a crisis team that is able to attend to this. So what's disappointing is that it has taken them so long in order to respond. And what we should put on record as well is that apparently management was not even available at the time when all this took place. Only the people who were at the night supervisors who were there at the evening had to take decisions on their own, and management only became available or aware of the situation in the morning. So that's very disappointing, because you expect,
The medical workers in their statement, in the letter to the President, say that, in fact, the Gauteng provincial government has not been very helpful. Communication has not been free-flowing. Would you say that the government in the province has handled the situation at Charlotte Maxeke in the best way possible?
With the current situation, I don't think they've done enough. I know that the Premier was hands-on and he was trying a lot earlier after the fire. But with the current one of the floods, I don't think enough has been done. We need more. We need him to be more hands-on and more involved, because he knows the situation in Charlotte Maxeke. And the fact that with the third wave, we struggled a lot with the shortage of beds because Charlotte Maxeke was not functional. Now we cannot be entering into a 4th wave of COVID, and again, Charlotte Maxeke is becoming compromised.
And in their letter, as they conclude, the medical workers say that we call upon you, Mr. President Ramaphosa, to urgently create a task team to direct the relevant manpower, including ministers of health, finance and public enterprises, as well as the Gauteng government, including the premier of the province and MECs of health and infrastructure, to urgently intervene in the crisis at Charlotte Maxeke. Do you think then such a task team is what is necessary to get the ball rolling?
We need something out of the ordinary. I think that something like that could assist. Because if you look at it, this is something that should have actually been done a long time ago. If you look at the problems that have been taking place over Charlotte Maxeke over the past few months, not enough has been done. We've had the premier there trying to assist with the other MECs, MEC of Health and MEC of Infrastructure and Development. But if you look at it in essence, because we've spent almost a year without the use of Charlotte Maxeke, we're going towards another year, Charlotte Maxeke not being fully functional during COVID, then I think it's about time that the president does an extraordinary thing and appoints such a task team so that things can be expedited. And we have got a full functioning hospital with people back for where they are. We already have a burden of other institutions surrounding Charlotte Maxeke. You are Rahima Musas and you Helen Joseph and so forth. So with Charlotte Maxeke being back on track, that will assist to alleviate the stress and on the other institutions.
And very quickly then, the COVID-19 situation. You are with Denosa in Gauteng, the current epicenter of the outbreak in the country. Tonight, we've recorded 16,000 plus new infections. Yesterday alone, Gauteng made up 11,000 of the new positive tests. What are you hearing from your members in hospitals about the situation? Is it fast evolving or still safe, shall we say?
Well, it is fast evolving from what we are hearing. Compared to the last few weeks, the situation has gotten, it's definitely fast evolving, and we are getting more and more patients into the hospitals. And with already the festive season, we are expecting that what normally happens during the festive season, there's a much more higher bed occupancy because of road accidents and things like that, and other contributing factors. So we are hoping that there should be a plan by the Department of Health to try and resolve this. And we are calling upon the public, those who have not been vaccinated yet, to do their part as well, so that we can be able to make sure that we do not put a whole lot more strain on the healthcare system and the healthcare workers. We've had to endure working through COVID for almost 2 years without even a proper increase in their salaries.
Bongani Mazibuko, the Gauteng Provincial Secretary of the Nursing Union, Denosa, good to speak to you tonight, sir. Thank you for your time.